Hello, I'm Dr. Bains. This is Lee. I've known him for 13 months now. We've known each other for quite a while. He's had a Myers cocktail before, and this is his second. However, today we're doing a little bit more. We are optimizing it a little bit more, making it a bit more bespoke. And so, because he's a personal trainer, he's been a personal trainer for 24 years now. We're going to give him what's normally contained within protein powders, which is a branched-chain amino acids and other goodies, but we're giving it to him intravenously into his veins. So it's going to consist of the basic Myers, which is your high-dose vitamin C, vitamin Bs, and magnesium. And on top of that, we are also adding branched-chain amino acids and another set of amino acid. It's called essential amino acids, basically. And this is to revive him completely. Not only when it comes to the enzymatic reactions, it will also help with wear and repair and recovery from exercise type of injuries. We like to prepare our Myers cocktail fresh on site. I just believe it's much more fresh, and that is Taf doing it. And everything is prepped fresh on site into saline bags, and it's preservative free. I think that's extremely important, and it also means that there's quality control because none of them have been sitting on the shelf for too long a period of time. So that's how we choose to do it. This is one of our favorites. It's a vitamin B. It's the one that gives it a nice little yellow coloring and always gives patients a thrill when they see it going in and being mixed in. It's a branched-chain amino acid going in now, and in the same way we'll mix everything else in. Taf is our IV physiologist, and he's the one who will be doing your consultation, getting to know you, and getting to know what you need. And he's basically our guy to make it as bespoke as you possibly need it. So that's Taf over there.
Hello.
And he'll be taking over.
I'm Taf, I'm an infusion physiologist here at Harpal Clinic, and I've got Lee as a patient today. And how are you, Lee?
I'm very good, thanks, Taf.
Good, thanks. So here we've prepared a cocktail for Lee, and Lee is having a Myers cocktail. Traditionally, it's Myers cocktail with a couple of amino acids. He's having the essential amino acids, which is essential proteins you need daily, and he's also having, especially the branched-chain amino acids, as an addition. So he's having 15 grams of vitamin C, which will be enough for him because he's experienced 7.5 grams before when he first came here. So today we're giving him 15 grams of vitamin C as well. In a Myers cocktail basically consists of vitamin C, consists of, some of them can consist of potassium, calcium, and magnesium, and a whole range of vitamin Bs, which is the B complex. In our particular Myers cocktail, we can either add if someone is deficient, or others we can remove if we don't see them feasible. For example, we haven't got the potassium today, and we haven't got the calcium. Prior to doing an infusion, we usually have a consultation which takes about 15 to 20 minutes, and I've already discussed with Lee what he's having today, which is what you can see in the whole bag. So the whole bag is consisting of 15 grams of vitamin C, essential amino acids, the branched-chain amino acids, vitamin B complex, and magnesium. So Lee is a personal trainer, which is why we've added these two essential amino acids in order to help him with his muscle recovery, because he does do a lot of physical exercises.
So with the vitamin C, why is it so high in regards to grams, and why have we gone up higher in dose with the vitamin C this time compared to the first time I had the Myers?
Okay, so vitamin C, high dose vitamin C basically consists of usually starting around, a higher dose is higher than normal recommended daily allowance, which is 90 milligrams. And Lee today is having 15,000 milligrams. Basically, we start here at 7.5 grams. We usually give people 7.5 grams of vitamin C, and that's considered high dose because it's it's a large amount you can take through your intravenously, and it's hard to obtain that amount of vitamin C through your stomach in a sitting. in one sitting, actually.
If I tried to take that amount of vitamin C orally through a supplement, from a tablet, would that be as efficiently used or absorbed as a cocktail?
Probably not, because it will be the same. It will work effectively the same. It will do the same job, but the only thing is when you obtain or have something orally, you're going to absorb possibly 20 to 80% of it, depending
I was
on
going
your.
to say how much is wasted.
Yes.
Versus, I imagine here we're not getting any wastage, correct? It's just straight into the bloodstream.
That's correct. You're going to obtain 100% of bioavailability of vitamin C today.
Right, yeah.
So which is also going to go through, which is why you're going through
You
the
know,
vein.
Hence why I would rather do this than supplement with an oral form, because I know that I'm not getting any wastage, and I know that I'm getting the exact dose, an optimal dose that I'm going to benefit from.
Exactly. So orally, if you have something, you have between 20 to 80% of the bioavailability, and once you have that amount, sometimes you may even have diarrhea just to try to obtain the same amount as you're obtaining from your veins.
Yeah.
So those are the higher risk of it. Otherwise, there shouldn't be anything wrong. It should just be as effective. Why people take high doses? Basically, vitamin C will kind of is a pro-oxidant.
Yeah.
It's a pro-oxidant. So once you have it inside your system, it will create what we call a hydroperoxide effect, which is going to get rid of the badness within your system.
Yeah.
Free radicals.
And so for like myself, where I've been through a lot of personal stress, the vitamin C at a high dose will help lower the stress in my body.
Not precisely, but many people who have vitamin C is shown to even reduce bad things such as to relieve pain.
Sure.
As you know, vitamin C will help you with healing of your wounds if you have some, or bruising.
Yeah.
So your skin can become better.
Great.
So that's what happens mainly with vitamin C.
That's why I have such soft skin.
Potentially. You may feel also that vitamin C helps with such things as adrenal fatigue.
Right.
So some people, when they're down, they have this vitamin C. It will give them an uplift.
Right.
Which is why we always have it in a higher dose.
Right. So
you won't get the same effect.
So there is a real physical effect that someone feels from doing a high dose of vitamin C versus just a small, glass of orange juice.
Absolutely. So not to say you shouldn't take your recommended daily allowance, but vitamin C does biochemically has a different effect in larger doses than it has when it's little.
Got you.
That's what the research says at the moment.
Right.
Presentation, discussed with Lee why you wanted to have a special infusion of micronutrients. So Lee, if you could tell me how you usually feel, or why do you feel like you need to have this sort of thing adjusted to your lifestyle?
Sure. Well, being in the career of health and fitness that I'm in, I'm not just about surviving, I want to optimize. And as much as I try to practice and preach to my clients about a healthy lifestyle and healthy living and healthy eating, it can be extremely hard, even for someone, myself, in the industry, to honestly say that I 100% all the time am getting all the care, attention to eating correctly all the time. No one's perfect. And so I look at the Myers cocktail as a way to supplement an already healthy lifestyle as much as possible, but this helps to certainly cover across the board any nutrients I might be deficient in, and helps to bolster my immunity. So yeah, I'm very much into not just being healthy, but optimizing my health. And from learning from yourself here at the clinic about what is possible with intravenous therapies, and now knowing that, I would be a fool to dismiss the benefit. Having had the basic Myers cocktail before, I had that at a time where I was extremely stressed with work, and I was starting to feel run down. So prevention is better than cure, and I came for the basic Myers with yourself, and within 24 hours I felt remarkably better. I felt like flu was coming on, but I was able to fight that off and get back to normal for the Monday morning.
For a normal person who's walking through our doors today and is not feeling kind of well and is feeling the flu symptoms, we usually start off with the General Myers cocktail, which hopefully would give them an uplift and improve their immune system.
Yeah.
From then onwards, they may need to just come in as and when they want to. Some people can come in once off, some people have to come in once every week, some people once every 2 weeks, and so on and so forth. This is only depending with what their lifestyle is, so we kind of accustom the Myers cocktail to people's lifestyles.
Great.
Not only the Myers cocktail, but especially infusion, as is yours.
Yeah, great. One thing that I appreciate here with all of you guys at the clinic is that you give a protocol that is specific to the individual, and so I'm very reassured that you give me the specifics that I need based on your findings from the consultation, from my blood work, and I feel in good hands that I know that you're going to give me the specifics that I need versus just a generic formula.
Thank you for saying that anyway, Lee.
You're very welcome.
But the thing is, one thing we have to do is, of course, like you said, we have to accustom things to people's lifestyle, which is the most important thing. One thing we always have to make sure is we have people coming from different places with different conditions. Some of them have to see the doctor before they come and see us here, or see me personally for infusions. And some people may be so ill that they need, if they have, let's say for example, someone who's got micronutrient deficiencies, multiples of them, sometimes they have to come in several times until they are within normality.
Sure.
And then they don't need to be coming back here. So it could be a one-off thing, and it could be a long-term thing to be doing.
Great.
For other patients who come into our clinic who've got minor deficiencies, they may be having, for example, vitamin B12 deficiencies. They may come here wishing or hoping to have a full bag of cocktails. It's not that they need. Sometimes they may just need a shot or course of vitamin B12 intramuscular injections, which usually take less than 3 minutes to administer soon after the consultation. We also have vitamin D shots, which you have. Other people may have vitamin D deficiencies.
Yeah, I come for the vitamin D.
So every now and then. Now that we're going into a darker months, we're in autumn right now. So now that we're going to darker months, usually I give people vitamin D supplements as well in the form of intramuscular injections, which they can have once every 3 months, or depending with their deficiencies, they can also have one every 2 months, or again, depending on their deficiencies, they may have a specific amount of international units to get them back to normality. I'm close to the end of Lee's infusion. The drip rate is nice and efficient. The bag is quarter less to finish. Lee, how are you feeling?
I'm feeling really relaxed, and to be honest, I didn't even realise at the beginning that you had even administered the IV into my vein.
Yes.
So, there's no discomfort, there's no pain, it's very relaxing, and I'm feeling really good.
Okay, so would you do it again?
Yeah, certainly.
Okay,
Certainly, I see the definite value of adding the cocktails to a healthy lifestyle, to supplement a healthy lifestyle, and to ensure that I am steering away from any deficiencies, and particularly as we're coming into the winter months, to keep my health optimal.
That's absolutely fine. So you can see this bag is almost finished there, and nothing's going to stop you from doing whatever you want to do. You can carry on with your daily life.
Yeah, right, yeah.
So we're coming up to the 45-minute end of this your drip, so you should be ready to go shortly.
Excellent.
Okay,
Thanks, Taf.
thank you.